To begin, I would like to introduce the York International team. First, we have Eugene Lee, who is the International Student Experience Coordinator. I am Anika, the student lead, and my colleagues here, Gagan and Sara, who are student coordinators. So by the end of this webinar, students will have more knowledge on the scope of UHIP coverage and how to access health as an international student. We'll also look at some key dates that are associated with UHIP, such as deadlines, enroll independence, payments, and even some communication methods. We'll also look at the difference between UHIP coverage and extended health care plan coverage, and we'll take a look at other wellness support available at York University for international students and how you could access them. In terms of the agenda for today, we will have UHIP, which is the University Insurance Plan. We'll talk about the extended healthcare plan provided by the York Federation of Students, YFS for short. And we'll also talk about the extended healthcare plan that is provided by UXA. We'll have our question and answer session, and then we'll talk a little bit about some pre-arrival webinars and events. Now we will get into all you need to know about the University Healthcare Plan, otherwise referred to as UHIP.
Yeah, I can take over now. Hello, everyone. My name is Siddhartha Lakshmanan. I'm the International Student Services Coordinator, and I'll be your first point of contact for any questions or queries you have related to the University Health Insurance Plan. Just to take you through the agenda for the UHIP portion of this presentation, I'll be talking firstly about how to navigate the healthcare system in Ontario, because I do recognize that it's quite a new healthcare system for a lot of incoming international students. I will touch upon your total healthcare coverage as a York University student, go into specific details about the University Health Insurance Policy, or UHIP for short, briefly touch on the extended healthcare plan, and it'll be discussed in depth later as well, and then also give you some health and wellness resources that you might want to access during your time as a York University student. So firstly, looking at how to navigate the healthcare system in Ontario. Let's say you're in Canada, you're not feeling well, where do you go? I think that's the primary question that a lot of international students are faced with. So I'm just going to break down the different healthcare services that are available to you as a resident in Ontario. The first and the primary healthcare service that you would access most frequently is known as a walk-in clinic or a family doctor. This healthcare service should be accessed for all non-life-threatening and minor illnesses such as cough, cold, flu, minor injuries, and so forth. This will also be the first place you go if you need a referral to a specialist such as a dermatologist or a urologist. This would be the first place that you visit for getting any healthcare related attention. The second service available to you is pharmacies. Similar to other parts of the world, they're responsible for distributing medication. Generally, these medications need to be prescribed by a practitioner or a family doctor. Labs in Ontario are also available to administer tests such as X-rays, blood tests, ultrasounds, and so forth. These also generally need to be prescribed by a general practitioner or a family doctor. In Canada, there's also something known as urgent care centers. These healthcare services are there to support you when you have minor illnesses or injuries that are not life-threatening, but require immediate attention. Examples of these include cuts or minor burns, diarrhea, vomiting, sprains, skin conditions, and so forth. Finally, you should only go to a hospital or ER when your condition is life-threatening. The emergency number to call an ambulance in Ontario is 911. This may be different from your home country, so please do take note. Now, while I've broken down the different healthcare services that are available to you as a student at York University, when you are actually sick, it might be difficult to discern which one of these you need to access. So for that, I have an excellent resource for you. This is known as the Health Connect Ontario Helpline. It's an 811 helpline, which is a free confidential phone service that connects you to a registered licensed nurse practitioner at any time you need. This is an excellent resource if you're looking to get some general health related advice from a nurse, They can also help you decide what is the best way to take care of yourself, whether it's just staying at home, making an appointment with a doctor, or visiting nearby hospital or clinic. Please take note of the contact information below, as this might be a very handy resource down the line. So now looking into your total healthcare coverage as a York University student, it's primarily made up of two important plans. The first is the University Health Insurance Plan, or UHIP, which is administered by me at York International. This is a mandatory health insurance plan for all international students, and it covers basic medical costs associated with hospital visits, clinic visits, lab services, emergency services, and so forth. Again, to reiterate, this is a mandatory healthcare plan for all international students in Ontario, not just York University. The second component of your healthcare coverage is what is known as the extended healthcare plan. This one is administered by your student union. This is not mandatory in the same sense as UHIP, as you may be eligible to opt out of it. However, the administrators that administer this plan will go further into detail about the opt-out procedure as well as the eligibility criteria for this plan. However, the important thing to note is that the extended healthcare plan covers services that are not necessarily covered under UHIP. This includes services of a dentist, eye and vision care, prescription medication, massage therapy, and so forth. So together, these two plans make your total healthcare coverage as a student at York University. Now, delving a bit deeper into what the University Health Insurance Plan covers, as I previously mentioned, it's a mandatory healthcare plan covering all basic medical healthcare costs. It has been specifically tailored by the Canadian government to cater to international students. What I mean by this is that the Canadian government provides a Ontario health insurance plan for all its domestic students as well as permanent residents and Canadian citizens. The UHIP plan is intended to provide the same coverage as OHIP to international incoming students. Students that are eligible for this UHIP coverage include all international degree students who are registered as active and are taking courses at York University, incoming exchange students, international visiting research trainees, or IVRTs for short, some visiting scholars as well, and dependents of all these students and scholars that I just listed above. The cost for UHIP is $63 per person per month. So for a full year of coverage, it would range from the fall till the end of the summer semester. That equals to a 756. But since as a summer start student, you would be beginning your term in May, we would be enrolling you for a 4-month period from May 1st, 2024 till August 31st, 2024. At the end of this period, when the new academic year starts, so fall 2024, and you're register for courses again and enroll for courses again, your coverage will be renewed. This applies to all international degree students. However, it's a key point to note that for dependents, IVRTs, and visiting scholars, you're not automatically enrolled or renewed into the program, but you just need to fill out this UHIP application form, which is a pretty simple online form that you need to fill out and provide some documentation to ensure that you get enrolled under the UHIP plan. So at the bottom right-hand corner, you see a QR code which takes you to the UHIP application form. If you're a visiting scholar, if you're a visiting research trainee, or if you're a dependent, or if you have any dependents coming to you with Canada, it's important that you take a screenshot of this QR code and come back to it whenever you need to fill out this form. Looking more deeply into the information on this slide, keep your dependents enrolled on time. The UHIP coverage is mandatory for all your dependents that are coming with you to Canada. It is essential and it is mandatory. The process of their enrollment is quite simple, as I just explained. You just need to fill out the UHIP application form. There are key deadlines associated with the enrollment of your dependent. Firstly, if you need to enroll your dependent within 30 days of their arrival in Canada or within 30 days of your coverage starting. So for example, if your dependent is arriving before May 1st, but your coverage only starts at May 1st, you would need to enroll them into UHIP by filling out this form before May 30th. As long as you're filling out the application form before that 30-day period, you do not need to worry about any late fees. However, if you do exceed that 30-day limit, then there is a $500 late fee that is applicable. I would like to reiterate that this is a UHIP policy, not a York University policy. So exemptions are very rare, and we want to make sure that, and it's a large sum of amount, so we don't want to charge this. So we need to make sure that we're enrolling our dependents at the right time. Another key point to note is renewing the coverage of your dependent is also mandatory, and it should be done within 30 days of the coverage expiry. So for example, for summer start students, your coverage right now will go from 1st May 2024 till 31st August 2024. Your dependent will also be enrolled for the same period of time. But at the start of the fall semester, when you're getting your coverage renewed, you need to ensure that you're filling out the UHIP application form again for your dependent so that their coverage gets renewed as well. I hope that's clear, but I'm happy to answer any questions at the end of the presentation if there are more concerns. Moving more deeply into what the UHIP plan actually covers, as I mentioned, it covers all hospital services in Ontario, physician services, which includes family doctor, general practitioner, as well as specialists. Eye and vision care, it covers limited because it may cover your doctor consultation and eye test component of your eye and vision care. However, prescription glasses would be something that are covered under your extended healthcare plan, which will be discussed later. Services by other practitioners, such as specialists, may need pre-approval by the insurance company. The pre-approval process is quite straightforward. You simply need to send an email to the insurance company detailing the specialist you're trying to access. And once they approve it, you can go ahead and use your insurance to access that specialist. Diagnostic and lab services such as X-rays, ultrasound, sonograms, and blood work are all covered under UHIP. Ambulance services in Ontario is also covered under UHIP. Emergency services outside of Ontario or outside of Canada are limited. Hence, if during your time as a York University student, you're planning to travel outside of Ontario or Canada, I highly recommend getting a supplementary travel insurance to ensure you have a complete healthcare insurance package. At the bottom left-hand corner, there's a QR code that takes you to the official UHIP website. It has a lot of details regarding coverage as well as cost associated details. So I would definitely recommend giving it a review when you have a moment. Okay, so that's what the UHIP plan covers. Now, how do you access and use your UHIP? UHIP is used through a document known as a UHIP card. In order to get this UHIP card, all you need to do as an international student is make sure your YorkU email address, which is the email address ending with my.yorku.ca or yorku.ca, is activated. If the email is activated, you will receive a email from the insurance company, Cowen, within the first few weeks of your semester starting with details on how to access your UHIP card. We highly recommend following the instructions, accessing the virtual card, but printing this card and keeping a physical copy with you at all times. Because whenever you go to a clinic or a doctor, they may ask for this, and it's always more convenient to present your physical copy. If you've not activated your YorkU email, please do so. If you don't see an email with your UHIP card within the first few weeks of the semester starting, please ensure that you email us at uhip@yorku.ca with your student number. I will take a look into your account and get back to you with next steps, but please ensure that you're including your student number so that we're able to help you more efficiently. Now, looking into how to use your UHIP card, there are two pathways with which you can use your UHIP coverage. First is going to a preferred provider. Preferred providers are essentially clinics or hospitals or doctors who have a direct link to the insurance company. So they're able to directly bill the insurance company. Hence, when you go to a preferred provider, you simply need to show them your UHIP card, access the medical service, and then you won't be needed to pay anything out of pocket. The clinic or hospital will just directly bill the insurance company. You can find a full list of preferred providers on the top right corner with the QR code, as well as on the UHIP website. However, we do recognize that accessing a preferred provider may not always be an option in emergency situations. So visiting a non-preferred provider is also an option that's available to you. So the only caveat is if you go to a non-preferred provider, you may require to be pay upfront at the hospital, clinic, or lab. However, you can get this money reimbursed to you by filing a claim online and submitting the claim form to the insurance company directly. I'll just take you through the process on the next slide. So when you go to a non-preferred provider, you'll be needed to fill out this claim form after paying out of pocket. Most of the information is readily available to you and can be found through the hospital. So although it's not a difficult form to fill out, it just adds a layer of documentation that you need to go through. You also need to make sure that you're keeping track of all your receipts and invoices and submitting that to the insurance company along with this form. If you scan the QR code on the bottom left corner, it takes you through step by step of how to submit this claim online. It's important to note that when you go to a non-preferred provider, it does not guarantee that you would get 100% of your money back, as there are certain policies that just differ between a non-preferred provider and the insurance company. Hence, we always recommend you going to a preferred provider whenever possible. Another important deadline to note in this is that whenever visiting a non-preferred provider, please ensure that you're submitting that claim within 12 months of your visit of that medical service provider. After 12 months, that claim is no longer eligible for reimbursement. So that's all that relates to UHIP. Briefly touching upon the extended healthcare plan. So the extended healthcare plan is administered by your student union. So if you're an undergraduate student, that would be the York Federation of Students, or YFS. If you're a graduate student who's not a TA, you'd be administered the extended healthcare plan by York University Graduate Student Association, or YUGSA. And graduate students who are a TA also get extended healthcare plan from QP 3903 unit. You can scan the appropriate QR code depending on which category you fall into for more information regarding these extended healthcare plans. However, we'll also be presenting some slides later on about these topics. Just to give you a brief overview of the differences between UHIP and extended healthcare plan, UHIP does not cover things such as prescription medication, dentist, chiropractor, eyeglasses, psychologist, and massage therapy. These would be things that are covered under your extended healthcare plan. Hence, it is essential that you're educated on both these plans. Finally, I want to also talk about some tips of just being healthy during your time in Canada. It is a new country with a very different climate than probably what you're used to back home. So it's important that you're taking care of yourself. It's important that you sleep well, eat well, consume enough nutrition. Make sure you're feeling good, because when you feel good, you're able to contribute to the community better. You're able to actively engage in classes, and you're able to enhance your overall experience during your time at York. There are several opportunities to take part in new sports, as well as gym that is available to all students. This allows you to lead a more active lifestyle, but at the same time allow you to meet new people and form new connections. Of course, your friends and family from back home are going to be your support system, but a lot of you are going to be spending the next 4 years, if not more, of your time in Canada. So it's important to start building those bonds and connections and social circles in Canada as well. And York University provides a variety of opportunities. You just need to be willing to take that initiative and engage with them. And also, I think as someone who works in international student services, we are here to ensure that your experience as a student in Canada is healthy, it's good. However, we're only able to support you if you're reaching out and asking for support. So I always encourage students to reach out whenever they feel they need some extra support as well. I'm just highlighting some general physical health and wellness, as well as mental health and wellness resources that are available to you at York University. I mentioned campus athletic and recreations. You can look into those programs by scanning the QR code on the left-hand side. There's also health support services. In terms of mental health and wellness, there is on-campus counseling available which is organized by the Student Counseling, Health and Wellbeing Department. It's free of cost and confidential for all students. So if you're in need of it, I highly advise you to take advantage of the service that is available to you. There's also the Keep Me Safe, as well as Good to Talk programs that are available to all students in Ontario. It's a free confidential phone service that can connect you to a professional that is directing you to the right resources that you need to best support you, as well as is just there to listen to you as well. So these are just some health and wellness resources that you can access during your time at York. And finally, I'd just like to leave you with a fact sheet that is released by the Ministry of Ontario Ministry of Health. This fact sheet just contains a lot of the information that I just explained, as well as some more frequently asked questions. I think the important thing with taking care of your health is making sure you're aware of all the healthcare services that are available to you. And such resources just allow you to be more informed. It's also available in a variety of languages. So if your friends and family from back home are interested in knowing more about it, feel free to share this resource with them as well. So that was the end of the UHIP portion of this presentation. Of course, I'm just going to highlight some resources that you can access to gain more of this information. There's obviously the UHIP website that you can go to for more coverage detail information. York International also has a UHIP webpage that details a lot of deadlines, refund policies, enrollment policies. So please feel free to review that as well. And I'm always available through the uhip@urq.ca. So feel free to email with your student number if you have any follow-up questions. We also have the regular drop-in hours that I organize. So if you just check the York International calendar, you'll be able to find some of those drop-in hours as well if you're wanting to have a one-on-one discussion specifically pertaining to your case. With that, I thank you everyone for listening, and I'll pass it back to Anika.
Thank you so much, Sid, for that presentation, for giving us all the information we needed to know about UHIP. So just a reminder, if you have any questions about UHIP, please place them in the Q&A section, and we'll definitely answer all those questions. Now we will move forward to our extended healthcare plan by the York Federation of Students, YFS for short. Now we'll go ahead.
Thank you, Anika. First off, I hope everyone's having an amazing day. My name is Jas Karn. My pronouns are he, him, and I am the director for the Health and Dental Plan for the York Federation of Students. To sort of talk to you all a little bit about the York Federation of Students, we are the central undergraduate student union at York University. What that means is the YFS is here to serve all undergraduate students, which means we're here to serve you. And this is in many different aspects. This could be whether putting together events such as, York Fest, Frost Week, Culture Fest, to campaign and advocate for you. This could be whether through things such as Fairness for International Students and fighting for free education. We also have over 300 clubs and they have almost any different interests for you to be able to join. And then we also provide cost-saving services such as the YFS Health and Dental Plan, which I'm about to talk about. So what is the YFS Health and Dental Plan? So the YFS Health and Dental Plan is the extended coverage for undergraduate students. It is a comprehensive supplemental plan, which all that means is it covers a little bit of everything. And for students who are enrolled in 15 or more credits, students are automatically charged. There are situations which I'll talk about later on, where students aren't automatically charged. But this could be things such as if students are part-time students, since they're under 15 credits for the full year, they typically don't get automatically charged, but students can still opt in using the opt-in application. If students already have coverage that is similar to the YFS Health and Dental Plan, students are able to opt out. And this comparable insurance can be through whether it's, whether it's like through an employer, whether it's through a parent, you have the ability to opt out as long as it's done prior to the respective deadline. So the opt-in, opt-out window. So there are 2 periods in which students can opt in or opt out of the YFS Health and Dental Plan, but it really depends on when you began your studies for the year. So for example, for fall term, and this is for students that are starting in fall term, the opt-in, opt-out window would be from September 1st, 2024 to October 18th, 2024. And then for students that are starting in winter, the period would be January 1st, 2025 to February 7th, 2025. Now, for example, if I were to start in fall term, this means that I would have to use the deadlines that are applicable to the fall term. So this doesn't mean that I have two different opportunities to opt in, opt out. It would just mean whenever you start, you have to use those respective deadlines. So students that are starting in fall term, they have full year coverage for 12 months. So from September 1st, 2024 to August 31st, 2025. And then students that are starting in winter term have an 8-month coverage starting from January 1st, 2025 up until August 31st, 2025. Opting out. So if students have been charged with the YFS Health and Dental Plan, you can opt out of it. However, you must complete the opt-out application right before the deadline in which the deadline applies to you. So just as I mentioned in the previous slide. So students starting in winter, they do have a different opt-out deadline, just as I mentioned in the previous slide. So it depends on when you started your studies. Opt-out eligibility. So it is a university policy for full-time students to be enrolled into an extended coverage. If students do have comparable coverage, they do have the ability to opt out. They just, again, have to fill out the opt-out application prior to the opt-out application deadline. Students do require comparable insurance. Again, this could be through an employer, this could be through a parent. OHIP and UHIP, they are not considered alternative coverage because they have different or unique coverages that are different from the YFS Health and Dental Plan, which I'll talk about later on. When filling out the opt-out application, you do have to sort of be really cognizant on how you're filling it because you only have one opportunity to be able to fill it out. You may not be able to verify alternative coverage sometimes. So Green Shield will sometimes send an additional email with additional steps. But as long as you fill it out prior to the deadline, everything should be good to go. So opting in. So as I mentioned earlier, students with 15 or more credits, they're typically automatically charged through their student account. There are situations where students aren't automatically charged, and that's just because they could be under 15 credits. So this could be situations where if students are part-time students, if students are registered with Student Accessibility Services, if they're graduating students, or if they're students that are with co-op, these are situations where students probably won't be automatically charged, but they still have the ability to opt in using the opt-in application, which can be found on our website, which I'll talk about later on as well. So in these cases, again, they can opt in using the opt-in application, but they also require further proof or documentation. This could be, if students are registered with Student Accessibility Services, they do require a letter of accommodation. For graduating students, they do require proof of graduation or a transcript. For co-op students, they do require things such as like a co-op letter or contract. Now, adding dependents. So students do have the ability to add dependents, but it is at an additional cost. This can be completed using the opt-in application as well. And within the opt-in application as well, it does require students to be able to provide their proof of relationship, whether it's through things such as a marriage certificate, a birth certificate, or any other documentation that states the relationship. There are only 3 different situations where students may add dependents, and this could be through whether it's a spouse, a common law partner, or a child. And these, okay, first off, I'm gonna preface that these are the rates for the current year, so they're not for the upcoming year, because those are subject to change. We just don't know the numbers or the amounts rather. But the rates do depend on the status of the student. So depending on if you're a full-time student or a part-time student, it does differ. And then if you'd like to add dependents, that also changes things as well. But for example, if I am a full-time student, the rate would be $281.32. But if I would like to add a dependent, it would be the additional cost. So it would be not only the $281.32 for myself, but if I would like to add one more person, it would be $282.16. So again, it depends on the situation of if you are a full-time student, part-time student, and whether or not you would like to add a dependent. Again, all this is applicable as long as it's done prior to the opt-in application deadline. And it'll make your life 10 times easier, just because after the opt-in application deadline, I don't have the ability to opt in any further students. Oh, there we go. Sorry. There we go. Okay, so what is covered? So I will say this is a very, very, very small list of what is covered on the YFS Health and Dental Plan. If you would like the full list, it is a pretty extensive document. I think it's about 30, 40 pages long. You can access that on our website, which is yfs.ca/healthplan. But just to sort of briefly talk about what's covered here, prescription medication is 80% up to $1,000. Acupuncture, physiotherapy, massage therapy is $50 per visit up to $600. Chiropractic care is subject to usual and customary charges per visit up to $650. Vision care is $75 per 24 months for eye exams, and then $100 per 24 months for glasses and contact lenses. And then dental coverage is 75% up to $600. Now, for some of these coverages, there are certain things where you do need to sort of look into it. So, for example, like massage therapy, you do require a doctor's referral. And then things such as dental coverage, it does only cover the basic level of dental coverage. So things such as braces and Invisalign and such, those are not covered under the basic level of dental care. So how to access the YFS Health and Dental Plan. So the plan is completely cardless, which means you don't have to, come see me, even though it might make me a little bit sad. But you don't have to come see me at all. You don't have to even email me. All you do need is the information that's listed on this slide. So it could be just your student number, the actual insurance provider, and then depending on if you'd like to see dental care, you do require the policy number. So for your plan member ID, it's just YFS, your student number -00. The insurance company that we have is Green Shield Canada. And then again, depending on if you'd like to go see dental coverage, like you do require division or your section number, which is YFS, and your policy number, which is 1111. And again, all this can be accessed on our website at yfs.ca/healthplan. So you don't need everything here memorized. Creating a Green Shield Canada account. So students that are using their YFS Health and Dental Plan, they should be creating their account, which can be done once their account is activated. Once their account is activated, they'd be able to access their account, and they can do all the different things listed on this slide here. So viewing benefits, checking coverage availability. The most important thing here is submitting claims online. So in case you go to some sort of service where they don't allow to bill directly to the insurance company, you are able to submit a claim using your Green Shield Canada account. You can also sign up for direct deposit reimbursements, which will make your life 10 times easier because you'll get your money back quicker. You can view your claim statements, and you can do a lot more. So if you do have the YFS Health and Dental Plan, please make sure that you are creating your Green Shield Canada account, because it will make your life 10 times easier. And then finally here, so we have two different emails for students. So the first one is the general email, which is healthplan@yfs.ca. So this email is if you have any questions regarding the actual coverage or how to opt in or how to opt out. And then the specific inquiry email, that is actually my personal email. So it's yfshp@yfs.ca. And then if you have any specific type of questions, I can definitely review your case, and then we can sort of contact there. But these are our two direct emails. If you'd like to see us in person as well, we are located at 336 First Student Center. So in case you want us to drop by, say hi. If you have any questions, you can also contact me there. But typically, like, I'm really good with my emails, so you can definitely ask me as many emails as possible. And then when it comes to our website, literally everything that I've said on this presentation you can find on our website, which is yfs.ca/health plan. You can access things such as the opt-in, opt-out application, your virtual card, your benefits booklet. Everything can be found on this website. There's also a really helpful frequently asked questions page at the very bottom. So in case you have any questions that were that I even answered already, they're probably already there on the frequently asked questions page. So feel free to drop in on that website. And yeah, and then outside of that, I think I'm gonna pass it over to Anika.
Thank you so much for all the information that you shared about YFS and all the details about the plan. I'm sure that students do appreciate the information. And if you have any questions, please continue to ask them in the Q&A feature so that we'll be able to address all your questions at the end of the webinar. So now we will be looking at, I will share with you some information about UGSA, which is your University Graduate Student Association, and we'll explore their extended healthcare plan. So just a disclaimer before we begin, the representative for UGSA who was supposed to be here to share this information with you unfortunately could not make it, so I will be sharing the information with you on their behalf. If you have any questions that are specific to UGSA, then I will provide you with their contact information so that you are able to ask all your questions and get all your inquiries answered. So the UGSA Health Plan is a supplementary health and dental coverage plan for prescription drugs, for dental, and it's basically just an extended healthcare plan that covers psychology sessions, massage therapy, chiropractic care, and so on. So the plan covers AD&D and travel insurance for up to 60 days for each trip. This plan is mandatory for full-time graduate students, excluding TAs, and is optional for part-time graduate students. This is an additional plan to UHIP or to OHIP. So full-time students automatically get charged and enroll in the plan, and students with comparable health and dental coverage can opt out of the plan within the deadline, and I'll provide those deadlines in a few slides. So the annual cost shown here differs for full-time and part-time graduate students, and the premiums are determined in late July. In terms of the cycle of the insurance plan, there is no enrollment for summer. So students are registered for fall and winter, and the dates would follow for the cycle, and it is included here on the slides. The blackout period happens at the beginning of the term and usually ends in September. So what we mean by a blackout period is that if you submit any claims with the insurance, it will not go through until after this period. But do not worry, if you incurred any medical expenses during this time, you could always submit them for reimbursement when the blackout period is over. So as mentioned earlier, the plan covers your prescription, dental, and even your vision needs. So here you could find a summary of the benefits, which tells you what percentage of the total cost of your plan will be covered. So to use your plan, your health provider can direct bill your insurance provider, which is your Green Shield. So your insurance number would be YGS plus your student number plus a 0. And an example is included here for you on the slides. So you can register with Green Shield through the link that is provided in the chat, and your account gives you access to services like submitting claims electronically, signing up for direct deposits, and a lot more. In terms of who can opt into the plan, it's for part-time graduate students, as well as dependents of full-time and part-time graduates if they're on the plan. So you can opt in by visiting the link for UXA website, which is placed in the chat. But please note that there is an additional fee for your dependents, and the opt-in deadline for fall is October 31st. The students with a valid alternate healthcare insurance in Canada that includes both drug and dental coverage can opt out of the plan. But please note that OHIP or UHIP is not counted as an alternate insurance. The deadline for opting out of the plan is October 31st, and you could do so by visiting the link that is placed in the chat. So to make a claim, places like pharmacies or dental offices, they will direct bill your insurance so you don't have to submit your own claim. All the claims are submitted through your Green Shield account, or you could also submit them by mail. In terms of coordinating your benefits, if you have any additional coverage from another insurance, the UXA plan allows for you to coordinate your benefits, which really means that once you receive payment from one insurance, you could submit this outstanding balance to your other insurance plan, and you could get reimbursed up to a total of 100% of the total cost of the service. If you have any questions about the UXA Health Insurance Plan, their email is placed in the chat, and the location of their office is placed here for you to visit when you come on campus. So we hope that you had the opportunity to learn more about health insurance plan, as well as the vast number of resources that are available to you as a York University student. So now we will give you an opportunity to use the Q&A feature to ask us any questions that you might have, whether it is about UHIP or about any of the extended health insurance plans that we talked about today. And I see we had one question in the chat that says to confirm if enrollment is free. So this question was around the time of the UHIP presentation. So I'll allow Sid to answer that question about whether or not enrollment for UHIP is free.
So hi, I don't know if you're referring to the enrollment process itself or the cost. So the cost of UHIP is $63 per person per month. The enrollment process, as I mentioned, if you're an international degree student, you will get automatically enrolled once you enroll in your courses. For your dependents, you simply just need to fill out the UHIP application form, and that way your dependent gets enrolled in UHIP as well. But their cost is also, as I mentioned, $63 additional on top of your $63 per person. I hope that answers your question, but if you have a follow-up, I'm happy to answer as well.
Thank you, Sid, for answering that question. So just take your time to think about any questions that you might have that regards to UHIP, what it covers, or where to access UHIP, where to access your UHIP card, which was went over in the presentation. Also finding healthcare providers. Being in Canada, that can be difficult, but luckily resources were provided for you here today that will help you to find a healthcare provider when you get in Canada. It's also important that you note the difference between UHIP and your extended healthcare. As we talked about today, there are a lot of differences. There are things that your UHIP will cover that your extended healthcare won't, or vice versa. So it's really important to note those differences. So if you have any questions, now would be a really good time for you to ask.
Just to add on to that, Anika, I think whenever you go to a doctor, you're going to be using both these healthcare coverages to ensure that you're getting the whole healthcare that you need, but it's important to know where to use which one. So I'll just detail a scenario. For example, if you're going to a doctor because you have a cold or a flu, the doctor consultation portion, you'll be using your UHIP to get that part covered. But when they prescribe you some medication that you need to go to Shoppers and get it, at that moment, when you go to Shoppers, you'll be using your extended healthcare plan to get those prescription medication from counter. So it's important to note these differences and know when to use which plan.
Thank you so much, Sid, for adding that extra emphasis. Yeah, so it's also just as important to know that at York University, we do have tons of health and wellness resources. As mentioned, We have the student counseling and well-being that are here to help you through anything when you get to York University and you feel like you need to utilize all these resources. Okay, and we will come back to the Q&A section at the end of the webinar, but now I will move on to talk about some of our upcoming events and webinars that we have. So just a reminder, the Q&A feature is enabled, so if you have any more questions during this portion of the webinar, then you could go ahead and ask. We'll touch bases again at the end. So just a reminder, also all links are placed in the chat for registration for the events that I'm about to go over. So first, we will have Yujin talk to us for a few minutes about the International Ambassador Program here at York International.
Hi, everybody. So for the month of April, we have this program called the International Student Ambassador Program, which is current international students who are here at York University. And you get the chance to connect with them one-on-one virtually, so through Zoom, for you to take this opportunity to ask questions, to get some of their insight on how they were successfully able to transition and adjust to life in Canada, and also to the academics at York University and the Canadian education system. So please scan the QR code. These appointments will only be available between April 9th through April 30th. I am going to share their website really quickly. So as you see here, it just gives you a bit of a description of what the website looks like and how does the appointment work. So right here, you can see that it's divided between each faculty. So for example, if we have a student from Glendon campus, you would click right under Glendon campus, click book appointment, and then it would take you directly to the appointment page. It shows you what days and times are available. Remember that these times are on Eastern Standard Time, so Toronto time. And then you would click the time that you would like, and then you would just add your information here, answer some of the questions. Have you received an offer? Have you accepted your offer on my file? What country of citizenship you are, your academic program, and then you have the option to write some of your questions. I would recommend think of some of those questions that you do think you're going to ask and add them here so that the ambassador is well prepared to be able to answer those questions, to show you the website, to show you the email or the contact that you can reach out to. So please, this is only for the month of April, so take advantage of this. And again, these are international students currently at York, so they will be able to, they've gone through all of the process that you are about to start. So take this opportunity to get a little bit of their insight. Thank you.
Thank you so much, Yujin, for sharing all that about the program. So we really hope you take advantage of the program. If I had something like this when I was starting York University, I would be so excited just to be able to talk to another student, to get their perspective, to have them answer all the things that you need. And it's a one-on-one conversation, which is even better for me, just getting that really one-on-one connection with another student. So we hope you take advantage of the program. So if you're looking for a fun event that you want to connect with other international students just like yourself, if you want to play some games, have really good conversations, and make friends before you come to Canada, then the YI Meetup is perfect for you. We play tons of games, go in breakout rooms, get to know each other, and get to know about York. And you may scan the QR code here on the side if you would like to register for the event. And if you would like to know more about the faculty that you're a part of and whether that is the Faculty of Health or the Faculty of Science and the different resources that you could take advantage of within your faculty, don't miss the opportunity to attend the Meet Your Faculty webinar. You will get tons of information directly from staff here at York University, and then you will have an opportunity to ask them any questions that you have in breakout rooms that are faculty related. And the link for registration will be placed in the chat. If you're looking to get to know more about York from a student perspective, then the Global Peer Program is exactly what you need. On Thursday, April 18th, we'll have our drop-in where you'll get to talk with a student here at York International, as well as here at York, they're international students just like yourself. If you have any burning questions or you really just want some tips and tricks about student life at York University, then the drop-in for GPP is exactly what you're looking for. So similar to the drop-in event that I just spoke about, we also have monthly community events with GPP. So you're still getting that opportunity to get all the information that you need from a student perspective, but it is a little bit different. So with the community event, we'll have a theme, and the theme it could look at your faculty. The theme could be about student clubs. It could be about anything that has to do with York. And we'll have mentors, and these mentors will share their personal experiences with you about being a part of a faculty, which I'm sure will be really, really helpful for you as an incoming international student. So definitely take advantage of this event, and you can register by the link that is placed in the chat. So another exciting webinar that we have coming up, which is my favorite webinar of the entire series. It gives you a detailed guide about what your first year as a York University student will look like. So I can't tell you how helpful this webinar would have been for me in my first year entering York University. If I had a chance to see what my first year would look like, then maybe I would have made a lot more decisions when it came on to starting university. So we'll talk about everything as it relates to dates, exams. We'll even have a sample timetable, which I know that is something that everyone should be interested in, to see what your workload could look like for your first year. So if this sounds interesting, then I look forward to seeing you on May 1st at 9 a.m. So here we have our event calendar that could tell you about the dates and the times of the webinars that we have coming up, and you'll also be able to register for these webinars. So please take some time to follow us on social media so you could be extra updated with our future events and our future webinars. But before we end today, I'll take a quick look at the chat to see if there are any last-minute questions about health insurance, whether it is about UHIP or the extended health insurance. No questions. So since we have no more questions, thank you all for attending, and we're looking forward to seeing you at our future webinars.